Number one, you have to know what type of dementia the person has. I'll have people say to me, well, it doesn't matter what they have. Well, absolutely, it does matter because they're going to present with different challenges. And so once you know what challenges may come, you're able to plan and prepare and get ahead of it. Preparation is so key. When you prepare in your mind first and then you prepare environmentally, you're able to manage the care a lot more confidently. And when you're able to manage the care more confidently, that confidence actually shifts to that person that you're providing care for.
I'm Riley Reese. This is the Sofia Unfiltered podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone. Welcome back to Sofia Unfiltered, where we're going to explore what it really means to live well, physically, emotionally, and spiritually. Today, we're talking about something we all need to understand: dementia. And this is not just for older adults or caregivers, but for anyone who wants to protect their brain, stay mentally sharp, and show up for their loved ones. We're joined by a licensed gerontology social worker and award-winning dementia and Alzheimer's educator who makes these big, complex topics easy to understand. So if you've ever felt confused about what dementia really is or how to stay ahead of it, this episode's for you. Let's jump into it. Dr. Macie Smith, welcome to the show. Thank you so much for being here.
Thank you so much for having me. It's a pleasure to be here.
Yeah. Can you just tell us a little bit about your background?
Oh my gosh. Well, I spent this month 25 years in the industry. I'm a licensed social worker. I specialize in providing support for those caring for individuals with Alzheimer's and dementia. I've written 2 compact guidebooks for family caregivers because I find so often that they don't know what they don't know, but they do know that they're struggling, and they don't have to struggle, because I'm glad in your opening you mentioned it's not just for seniors to learn more about what Alzheimer's and dementia is, because everyone with a brain is at risk. We are all one accident, one injury, or one illness away from becoming a caregiver or from needing a caregiver. So it's very important that we understand what normal age memory impairment looks like so you won't be freaking out, but also to better understand the true early signs and symptoms of a progressive type of dementia. Because what we know now is that if medications are provided in the early stage of the disease process, you won't be able to change the trajectory of the disease process, but you may be able to delay or slow down the progression of the symptoms of the disease, which would be dementia.
Okay, that's incredible. So for our listeners who may not know, we know it's kind of an umbrella term. What is dementia?
So dementia is an umbrella term. So you think about an umbrella and it has so many different prongs. And so dementia itself is a group of behaviors or a set of symptoms that a person displays as a result of having a condition that's impairing their cognitive ability. It could be a treatable type of dementia or a temporary, or it could be a progressive type. The reason you hear Alzheimer's and dementia used interchangeably is because Alzheimer's disease is the most common type of dementia, or the most common cause of dementia. And you also hear a little old timer sprinkled up in there too. Now, that's not a thing, although you can Google it, it's going to come up, but it's not an actual diagnosis. We hear our older population and our elders talk about old timers a lot. They don't really have the science behind why they call it that, because they see if someone who's older starts to forget stuff, oh, it must be old timers. They talk about it as if it's a normal part of aging, but it is not. Having dementia or Alzheimer's is not a normal part of aging. However, age is the number one risk factor for developing it, but simply because you're getting older does not mean you're going to get it.
Okay, and you also mentioned it could be a short-term condition as well. What are these other conditions?
So when we think about the short term or the temporary causes of dementia symptoms, which would be the forgetfulness, the confusion, disorientation, if you notice that it comes on suddenly, It's more than likely not dementia. It's probably delirium that could be caused by an acute illness, fever, lack of sleep. Those areas also play into reversible type of dementia or pseudo-dementia, faux dementia, whatever you want to call it. It could be brought on by a urinary tract infection, so an acute illness. It could be brought on by depression that's not treated. It could be brought on by medication side effects or medications fighting against each other. When we think about our older adult population, they're seeing several different doctors. They have specialists, oncologists, urologists, neurologists. And what's happening is you got all these different doctors prescribing medications to treat the same illness. And so those medications could be fighting against each other. And so those areas can be treated. Diabetes can increase one's risk of developing a progressive type of dementia or a treatable type of dementia. If your A1C levels are not where they need to be and your blood sugar levels are not where they need to be, then you could have dementia symptoms, confusion, irritability, agitation. But if you treat diabetes, if you treat thyroid conditions, that's also a contributing factor. You'll actually see those symptoms dissipate because the dementia that you saw was actually caused by something that could be treatable. Sleep is another area. We underestimate the power of sleep. It's just like anybody else. If you don't get enough sleep, then you might not be too sharp during the day. You're not going to be the brightest apple on the tree. But if you get that required amount of sleep, 7 to 9 hours of sleep every night, then you'll see that you'll become, much more clear and conscious of what you're doing and saying.
Wow, this is interesting. So I don't even know how people would put this together. And this is just mind blowing. What are some of the other symptoms in this dementia space? Because it's not just memory loss.
Excellent that you said that. A progressive type of dementia, it's much more than memory loss and forgetfulness because we all forget where we put our keys. We all forget where we put our cell phone. Sometimes we may forget where we put our children, but we find them and they're not harmed, right? We had them in a safe place. But you can actually retrace your steps and say, hey, okay, this is what I did. This is what I did. Okay, here it is. Someone with dementia, because of that forgetfulness and that memory loss, now it's impairing their life. It's impairing how they go about their day. It's impairing their routine. Everybody's forgotten where they park their car at the store. They find their car. Sometimes you have to go back to the entrance of the store and kind of use your visual cues to remember, oh, I parked the cart section. But if someone has a progressive type of dementia or it's developing, they find their car, but now they're having trouble on what to do next, how to crank the car, how to back up the car. Or if they get all that done, now they're having trouble finding the right way to get home. So now they're getting lost in familiar places. That's how you know that something is happening. It might not necessarily be dementia, but because it's a cognitive concern, then it's some type of cognitive impairment. And so you want to seek medical attention from your primary care doctor. Do not go to the hospital. I don't believe in seniors or older adults going to the hospital unless they absolutely have to. If it's an emergency, this is not an emergency. You can make an appointment with the primary care doctor and talk about what you're experiencing. If it's the person that's actually experiencing the symptoms, talk to the doctor about what you're experiencing. Don't talk about a diagnosis. Let the doctor do his or her job. They got a degree. You don't. Don't go in there and say, Doc, I think I got dementia because my mama had it, my sister had it, and my two cousins up the street had it. No, 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 no. You talk about the symptoms. What should happen is the doctor should do blood workup. They should establish baseline to determine what happened to make this that could possibly cause this shift. It could be, we talk about depression. It could have been a major life event that occurred that's causing stress. And that stress is causing some cloudiness and some impairment cognitively. But you have to be able to share the information with the doctor so they can start that screening process to determine what it could possibly be.
Oh, that is so smart. And that is also scary that stress can have such of these big effects on our bodies, on our mental, physical, and
Absolutely.
emotional health. I mean, you're just bringing it all together, and this just does it. So, you're talking about spotting the signs in yourself, potentially in others and family. What are we looking for in that change of behavior?
So people who live with dementia, they do hide it very, very well. So don't look for your loved one to tell you. If they do, that's wonderful. That's a non-issue. But it's normal for them not to tell you because If I tell you I'm already aging, I've already experienced loss. I've lost family, I've lost friends. In some cases, I lost abilities. I may no longer be able to do the things that I used to do. And now, if I tell you that I am fearful of losing my mind, now I may lose my home. So now you may put me in a nursing facility or assisted living with 100 other strangers, and I don't want that. And what we know now that we did not know then about progressive types of dementia is that the person begins to experience the symptoms 15 to 20 years before anybody else does. So by the time
Whoa,
yeah,
15 to 20
15 to 20
years?
years. So by the time someone else
Mhm.
notices it, they've already been dealing with it. The first stage, outside of no stage at all, is subjective cognitive impairment. They're noticing it, but nobody else knows what they're dealing with and what they're trying to rationalize and reason. If you see somebody become very upset and very agitated over losing something, just something simple like a pen or a piece of paper, something that can be replaced. If they become very agitated about it and you say to yourself, why are they becoming so frustrated about a pen? We got several pens. It's because they've been dealing with it years before and they know now that it's getting worse. They're rationalizing, but the person on the outside looking in, they have no idea, but that is an indication. Also, let me say this too, when we talk about early signs of a progressive type of dementia, it's not just gonna be memory loss, or you may not even notice that they're forgetting stuff because they do well at hiding it. Also, they may have built up a cognitive reserve they can accommodate for their loss. So we have to also look at language changes. That can be an early sign. They may no longer be using the words they used to use. They may have used, jargon and big words and educated words because they're, academician or what have you, but now they're using more simpler words, more primary words. And you may be saying to yourself, oh, I guess they just don't feel like using those big words today. I guess they're, just chilling today. But really, they can't remember those words and they can't put them together. And so you don't pay it any attention. Also, to the way they dress, the way they look. If they're always wearing a full face of makeup, their clothes are always matching, they're always wearing heels or they're always wearing loafers or what have you, but now they're like in sweats as opposed to a suit. Some guys I know, they wear suits all the time. The only thing that might change, sometimes they may wear a tie, sometimes they may not. They never wear jeans. And so if you notice someone you care about, then now they're dressing down a lot. They're wearing jeans, they're wearing sweatsuits, and they've never done that. And you're saying to yourself, oh, they got with the program. Now they know that they can dress down on Mondays and Tuesdays and Wednesdays. But really, there's something happening cognitively that's affecting their decision making. So language, the way they make decisions, the way they dress, the way they look. And then when you go into their house, you'll see a lot of things too. You may see more clutter because, now they're getting confused as to where they put things. And now if they don't see it, then they won't remember it. So they got to put it out where they can see it. But now you come into their house and like, this house is always spotless, but now, stuff is everywhere. You don't think about that being tied to dementia, but you would definitely want to consider that as well.
Wow, this is great for caregivers. I mean, family members, etcetera, to start they're gonna be the first ones who maybe notice this. And are these the small shifts that happen 15 to 20 years prior?
So what we know, what happens in the early stages, again, they're very subtle signs. They look just like normal age memory impairment. The person can live independently in the early stages. They just need reminders about things. So early is just very, very subtle. They may forget a word but use a different word. They may forget a step in making coffee, but then they just use a different step. So they're still able to do things. So those early signs are very, very, very subtle.
Okay, so you mentioned a blood test and you mentioned a high risk, is age. Is this something where you should go in and are there markers that we can start testing in our blood?
I only recommend that someone get a blood test for progressive type of dementia only if they see, a direct lineage related to the disease process and they can see that there are several frontline relatives and that line is coming directly for them. You want to get a genetics test. So, and that's not something you would get that done. You won't get that done in a primary care physician's office. You'll need to get it, go to a genetics testing place to get it done. And they would test for the particular Alzheimer's genes. Now, I will tell you, less than 5% of the Alzheimer's that we do see is considered familial, early onset Alzheimer's disease. That means that the person has Alzheimer's gene, the presenilin gene, or the APP gene. If the person has the presenilin gene in particular, the research supports 100% chance they're gonna get early onset Alzheimer's disease and 50% chance they're gonna pass it to an offspring. The APP gene, that increases their risk of significantly of getting it, but also passing that gene on to an offspring. So that is when I would say definitely get tested. But other than that, there are other genetic codes that put people at higher risk, which is the APOE-4 gene, mostly found in women. But that doesn't necessarily mean that you're gonna get it. It's not even really a predictor, but it could be considered a biomarker for the development of it. But, if you get it and if you think that you may be in line to get it, absolutely get a genetics test, but, talk with the doctor about what those risks look like for you. So vitamin B12, which is huge when it comes to brain health, vitamin D, vitamin C, vitamin E. Some of those vitamins, especially vitamin B12 and D and E, if they're low in it, it's going to cause cognitive concern. It's going to cause memory problems. It could cause lapse of judgment. And so it's going to affect their cognitive ability. Those particular blood tests that are done in a doctor's office is to help establish baseline and to help rule out treatable causes.
If we have a vitamin deficiency now, is that something that can also cause maybe some symptoms, brain fog?
Sure. Right. And so if you have a vitamin deficiency, you should know, and then you would want to take your vitamin D supplements. But again, don't go out buying all these supplements if you don't need them because they're going to have adverse effects.
Right, definitely get a baseline. But that's something everybody could do today to take care of our brains. So,
Oh
talking about
yeah.
just brain health in general and what we can do, what should we be doing now? Is there anything we should be doing now?
Well, eating well, eating a well-balanced diet. I don't promote any type of diet. As a matter of fact, I don't believe in dieting at all, but I do believe in making healthy meal decisions, right? So when you're creating and you're developing your meal plan and selecting meal options, you want to be very mindful in how you select that. And everybody is different. Everybody's body is different. I do like the Mediterranean diet, which is an anti-inflammatory diet plan. You want to stay away from the middle aisle in the grocery store, which is a problem for me because I can't cook and all that fresh stuff. I have to, it's a challenge for me, but I go out there and I do it. So I'm buying fresh produce. Yeah, I still can't cook, but I be trying, right? You also want to stay engaged with people you enjoy being around. So stay socially engaged. You want to stay active and exercise 5 days a week, staying active, exercising, getting sunlight. Sunlight, that's your serotonin, that's your vitamin D. That's going to help promote good mood. When you're in a good mood, that's when you do more things. As you're being socially engaging, you want to continue to learn new information. We have to be lifelong learners. Stop looking at the same Lifetime movies that you've been watching for the past 50 years like me and cry at the same moment every time because you already know what's going to happen. No, you want to watch new movies. You want to read new books. You want to learn to play new musical instruments. You want to go new places. You want to explore, learn a new language. When you're learning, you're building neurons. You're firing off those neurons. They're making those connections. You're building a cognitive reserve. So if you were to develop Alzheimer's or a progressive type of dementia, you could absolutely delay the dementia, which are the symptoms, because you have developed so many neurons that you can accommodate for your losses. And we do know that, if you don't use it, you will lose it. That's just not for skill set. That is for your brain too. Start doing crossword puzzles and not word find because you are simply circling the words you already see. You didn't think about anything. And so we want to be lifelong learners. And then we want to not necessarily control our stress, but we want to reduce our stress as much as possible. We need for it to be managed. You're always going to be stressed because if you are never stressed, then you're probably dead, right? So you want to be able to manage your stress and you want to manage your co-occurring conditions. So if you have high blood pressure, high cholesterol, diabetes, asthma, you want to be sure that those chronic conditions are managed because if they are not, then they do increase your risk of developing a progressive type of dementia.
Where does food come into this? Just out of curiosity, how does food help?
So when you're eating, just say if you're eating unhealthy food items, food is the biggest culprit for inflammation in your body. When you have inflammation in your body, you have inflammation in your brain. And that's what's going to cause the cloudiness, the confusion, the inability to make decisions. So it really is tied to inflammation. When we think about just the food coloring that are in foods, what is it doing to our body? When we talk about artificial things, so those artificial sweeteners, I understand that you are drinking sugar-free food items because of course you want to keep your sugar low as well. You're eating and drinking sugar-free items, but what are they sweetening it with? It is artificial sweetener. Artificial sweetener has been linked to developing progressive types of dementia. If it is artificial, then it's not natural. You want to ingest things that are made from a plant, but not made in a plant, if that makes sense.
Awesome. I like that a lot.
And as much as you can, I mean, I live in America, right? And I am very well aware that we are not living in a healthcare system. We are living in a sick care system. Uh, America makes money on the backs of sick people. How do people get sick? Through what they eat, the air they breathe, and the water they drink. In my hometown, 5 miles from my hometown, probably 10 miles from there is Denmark, South Carolina. Yeah, next to Sweden, Finland. I'm serious, right? They're dealing with brown, unsanitary water that they're drinking and bathing in. There is no way in the world that in 2025 human beings should still have to be contending with that, but we do. And so when you know better, you do better, but only if you can. And that's why, it's always going to be a battle and a fight when it comes to the marginalized communities and people who are still living in communities that don't even have clean water. How in the world are they going to reduce their risk of developing chronic illness, and especially developing an illness that is the only illness in the top 10, Alzheimer's disease, that can't be treated, cured, or even prevented?
Yeah, that's definitely a really bad situation when you talk about the water in some parts of the country, and it's not just in the Carolinas, that's all over
Y-
the place, right?
Yeah,
So
yeah,
that's
absolutely.
so you started to mention some of these preventions or holistic wellness-based approaches to health. y- And there's free ones too, like meditation, right? So to control your stress, what else can people be doing to integrate into their lifestyle to help them?
This is gonna sound real basic, but I have to say it because people aren't doing it. Taking time away and taking time to be with themselves. Take time to be with you, right? Scheduling into your day or into your week or into your month a day or some time just for yourself to do nothing. I do say, ensure that you're lifelong learners, but mindfulness is a real thing. Also, not thinking is a real thing. You want to have time to rest your body, but also have time to rest your mind. Think about the things that you enjoy doing, and you'll be amazed as to how many people don't know what they enjoy doing these days because of all of the rigmarole, all of that instant access, all of the care responsibilities. But
Social
really,
media, families, kids,
exactly.
burdens,
Exactly. Email. You know what I mean? You are always the news, right?
eh,
You are always on. FOMO, fear of missing out. You are always on. When you are always on, you are never off. And you have to be off in order to be able to reset, to be able to rejuvenate. But first, you have to start off with identifying, what do you enjoy doing? I don't care if it is sitting down, twiddling your toes. That's you. Do you, boo, right? Write that down. Have a list of things that you enjoy doing and write that into your schedule. On Tuesdays from 3 to 4, I'm going to sit and just look at my back porch. Because a lot of times, if you don't schedule it and if you don't write it down, you're not going to do it. But if you write it down, then it's real and you're more apt to do it.
yeah, and I love how you said like mindfulness is a thing and turning off is a thing, and they're very different,
They're very, very
very,
different,
very different
but they're both equally powerful and equally medicinal and healing.
and equally free.
Equally free. I like free. I like good and free.
It's free, meditation's free. Turning off your phone and social media and the TV for a minute is free.
It's
Taking a
going
minute
outside, the sun. It's free vitamins. And I will tell you, if you are in tune with your body and you're in tune with yourself, your body is the biggest predictor of what is good for you and what is not good for you. When if you just say if you've been in the house for like several days, right? Didn't go outside or anything, when you make the decision to just walk to your mailbox, you will instantly feel a level of relief and release and happiness, right? Because again, when you're happy, you do more, you are more, and you feel better. And so, don't underestimate the power of a good, sunbathing for sure.
Yeah, I love all of this, and if that's gonna build brain health and keep us healthy in the long term, I think that's incredible. I think this is also a scary topic, right? You start worrying about your parents and aging and, is this gonna happen because it seems so common, aging and memory loss, right?
Yeah.
So, there is a way to live well even with dementia, right? And you've been in this industry for a very long time. Do you have any kinds of stories of people kinda living well?
Yeah. Well, it is a new normal, but you have to get ahead of it. Number one, you have to know what type of dementia the person has. I'll have people say to me, well, it doesn't matter what they have. Well, absolutely, it does matter because they're going to present with different challenges. And so once you know what challenges may come, you're able to plan and prepare and get ahead of it. Preparation is so key. When you prepare in your mind first and then you prepare environmentally, you're able to manage the care a lot more confidently. And when you're able to manage the care more confidently, that confidence actually shifts to that person that you're providing care for because they are very attuned to nonverbal communication, people with dementia. And so people can live well and they do live well with the support of a competent, compassionate, reliable, and patient caregiver or team of caregivers. What I have to do with some families when I go in and do consultations is we have to actually compartmentalize the responsibilities because if Johnny is not patient, but he is real good with money, Johnny gonna manage the finances. But if Mary is patient with mama, then Mary's gonna be the one to bathe mama and prepare her meals. But the non-pharmacological strategies are what I find to be most powerful. And I only recommend medication as a last resort because it is a condition that is going to progress. I mean, it's not treatable in terms of the disease itself. So, what do you have? You have care, compassion, and people to be there to provide the support. So, one of the things that I often recommend is reminiscence therapy. So people with dementia, they tend to forget the most recent information. I always say the latest information is the lost information, but the memories and the information in the back of the brain, they were able to store before the disease process. So you as a family member and as a caregiver want to reach those memories that they still have. So that way they can participate in the engagement process. They can participate in the world and in their life. So one of the things that I recommend is reminiscence therapy, and so I recommend looking at those brown photos, those black and white photos to be able to bring them into a space where they can contribute again to their world and to their environment and to this conversation. And so when I shared that with families, I had someone share a video with me recently where they actually implemented reminiscence therapy as opposed to trying to change the course of the disease process and trying to change the person into remembering things and they can't. They were very clear and they exhibited clarity during that moment of reminiscing about the old pictures, going through the album, looking in the album, actually clearly talking to the daughter clearly talking to the person with dementia. And that was a moment of understanding. And that's what it's about. It's no longer about the days, it's no longer about the weeks, the months, and the years, but it is about the moment. You have to meet them in their mind and meet them in the moment in their mind to be able to establish that connection and to be able to promote quality of living for the person with dementia, but also for the caregiver. Very, very powerful.
Dr. Macy, thank you so much for bringing all of this information. But before you go, we have a question that we ask all of our guests on the show. If you could, with our audience, share three fundamental pillars that contribute to your well being.
Oh, yes. So the very first thing, and I'll just tell you about my routine, and I've been doing it ever since I figured out I was in midlife because I still thought I was in younger life, but I'm midlife. So number one is praying. I'm very faith based, and I remember a pastor said in his sermon one time, the moment you figure out God is all you have, with whatever you're going through is the same moment you figure out God is all that you need. And that resonated with me so much. So I pray, I meditate, I exercise every morning, and I don't cut the TV on, and I don't listen to the radio for at least 3 to 4 hours in the morning. So even if I'm in my car going somewhere, I don't listen to the radio because I'm experiencing mindfulness at that moment. I'm spending time with myself. If I'm at home, I'm seeing the bluebirds, I'm seeing the redbirds. So I make it a point not to bring in any external distractions if possible for 3 or 4 hours. And once I've done all of that, then I'm well with myself. My family appreciates it. My colleagues appreciate it. And I show up as I feel as a better person, as a more confident person in an effort to be able to meet the needs of the people I support.
And you always hear, right? Aren't you supposed to fill your cup before you give to others? And that
You
sounds like
have to,
and
yeah.
that's what it sounds like you're doing. And you're making sure that's built into your daily routine.
So you have to set those boundaries. You have to have, those expectations put in place and you have to follow them. And I do. So that way I can ensure that I can give enough of myself without overextending myself to these different pockets of people and experiences. And then I still have me because I love me. I love me some me. And ain't nobody gonna love me like me, and ain't nobody gonna love you like you. But you have to be able to spend time with yourself to decide, what it is about you that you want to preserve forever.
Yeah, I love that. I love that you're not waking up going straight to emails, news. You just have your moment. That's such a powerful way to build your day with
It is,
yourself.
and I'll tell you, I mean, and even if you can't get your full time in, just a piece of it, number 1, makes you feel as if you've accomplished something, because when you don't plan for it and you have an off day and you can't get it done, you tell me, how many times have you felt like a failure? How many times have you felt like, "Dang it," you're just down on yourself, and you're putting yourself down and you're not motivating or uplifting yourself, and you don't want that because that brings on an additional layer of stress. And so you want to give yourself grace and you want to give yourself permission to take time off, to take the day off. It's okay, right? But you have to give yourself permission. Don't wait for somebody else to do it because they ain't gonna never do it because they enjoy what they're getting from you.
Yep, absolutely. I know, and I know exactly what you're saying. Like I've got all of these prenatal vitamins to take, and if I can get up, get them all taken in the morning, get all that done. Yeah, I'm like, oh yeah, I got all these vitamins in, done, off my list, and it's out of my brain. Think about,
Accomplishment.
yeah,
See, my thing is, it's just like anything else. How do you feel when you accomplish something at work and your boss say you did a good job, right? But at home, and it has nothing to do with work and it has nothing to do with a boss, but it has everything to do with the most important person in your life, you. Right. You're saying yourself, atta girl, atta boy, you did it, you go girl, you got this, right? Can't nobody tell you nothing after that. Cause baby, I'm gonna tell you, when I wash clothes, dry them, and fold them up in the same day, oh,
it's a win. It's a win.
I'm queen for the day.
Yeah, 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 absolutely. I love that you just take the time to celebrate these small wins as people should.
Oh yeah, all day, all the time. I mean, why not?
Yeah,
There's no harm in it,
and it's free.
and it's free. I love that, and it's free.
Yeah, absolutely. Well, thank you so much for being here, Dr. Macy. Where can our listeners connect with you? How can they get some more information? I know you have some books.
Yeah, I do. Thank you for asking that. So I am on social media at Dr. Macie P. That's MACIEP as in Paul on Instagram. On Facebook, I'm at Dr. Macie P. Smith. I'm also on YouTube, and that's Just Ask Dr. Macie, MACIE. I have 2 books, and they're specifically for caregivers. They're very compact. The first one is a Dementia Caregiver's Guide to Care, Frequently Asked Questions. And the second one is a Dementia Caregiver Call to Action, The Journey, what it looks like to care for someone with dementia. And I have a whole host of blogs and vlogs at synergyhomecare.com/resources. Just click on the Dr. Macie Smith tab.
Thank you so much for showing up and being such a huge support to caregivers and in this hard time. And I'm blown away with the information. So I can't wait for the show notes to come out. So thank you for being here.
Thank you so much. Pleasure.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sophia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.